Hi everyone, I'm Kelly Lees from the National Varroa Mite Management Program, and I want to talk to you about monitoring decisions. Monitoring is the key to Varroa management. It allows you to accurately determine your mite load, which helps you decide when to treat, what to treat with, and if you need to treat at all. Now, if you don't have Varroa yet in your state or area, it's really important that you continue to conduct surveillance. Active surveillance for mites will enable early detection, and that will allow you to manage your mites better. When Varroa arrives in your area, or if it already has, we're in the build-up phase. And during the build-up phase, you're going to need to monitor your mite load every 4 to 6 weeks because reinfestation from the environment is very high. Now, it's really important, as beekeepers, we love to save money. Don't just treat by the calendar. There's lots of treatment schedules out there, particularly from overseas. But if you're actively monitoring, you're going to treat when and if you need to by measuring that mite load really regularly. Now, how you actually monitor will help inform your management decisions. So if you've got a few hives or you really want to monitor all your hives and you wash one hive at a time, you're going to get a really accurate mite load for each hive. You'll know exactly how many mites are in each hive. If you wash multiple hives at once, so if you do a bulk wash, what you're going to do is you will confirm mite presence and you'll get an estimate average number of mites across the apiary, but you will not get an accurate mite load per hive. Now, this will inform your management decisions. Now, how you determine these thresholds and implement your mite control is going to depend on your operation. If you've only got 5 backyard hives, you might choose to monitor every single hive. If you've got large loads of 90 to 120 hives, you're more likely to do a bulk wash. Regardless of how you do this, you need to consider a few things. You need to think about integrated pest management, which we'll talk about in a minute, but it's basically a range of treatments. You need to think about treatment rotation. So if you're already treatment, what treatment have I used? Which one can I use next? You also need to think about the time of year, what season it is, and what phase your colony's in. And what is the cost versus benefit analysis of treating some hives or treating all hives. So you've got threshold. Do you treat only infected hives or do you treat all hives? Now, if you only treat your infected hives, there may be other hives in that apiary that are being reinfested from the environment, so they may not be at threshold yet, but they may reach threshold during the time treatment is in the other hives. So you have to consider, is it worthwhile only treating hives that are at threshold or treating all hives because at some point those hives are going to reach threshold? Or do you treat all hives knowing that in a build-up phase you are going to have reinfestation not only from the environment but from your own apiary? Now, the best way to manage Varroa is using a range of strategies, and this is known as integrated pest management. Sounds like a fancy term, but you're already doing it. All it means is that you use a range of strategies to manage a pest or disease within your honeybee colony, in this case Varroa. Want to stress again that monitoring is a cornerstone of Varroa management, and in this case, integrated pest management. So in terms of Varroa and IPM, what you have is a range of different kinds of treatment that range from chemical and mechanical and cultural controls when they're available. So mechanical controls are things like drone trapping, queen caging. Your chemical controls are your synthetic and non-synthetic compounds, and your cultural controls might include Varroa-resistant queen bees when they're available in Australia. Please enjoy the rest of the course.